Thanks for tuning in to the latest masterclass, this time focusing on plyometrics and jump training. So a slightly different take on how I've structured this. So before I've done it, I've kind of given a little bit of a introduction to what that guest is going to speak about. And I've mixed the guests up depending on the theme. So I've done it slightly differently because I thought that I was potentially losing a little bit of context by not using the original question, therefore not framing the answer correctly. So what I've done this time is put each guest who features on this masterclass in their own little section and use the question that was asked at the time. So you actually get the detail, so you get the context, hopefully. And I will just add a little bit in between each guest to set the scene of the guest number, what they spoke about, just to offer a little bit of additional context before we actually get into the questions that were asked on that episode. So hopefully this is as beneficial as previous episodes, because I've had some really good feedback on them. So if it does work, let me know. If it doesn't work, definitely let me know, and you like the previous the way I previously structured it. So without further ado, we've got Bouchek Snyder from episode 212, who's going to start off. Then we've got Eamon Flanagan, we've got Lachlan Wilmot, Mark Jarvis, Jeremy Shepherd, Dave Hamilton, and Hakan Anderson. So an absolutely jam-packed, star-studded lineup for this plyometrics and jump training masterclass. So first up from episode 212 is Bouchek Snyder, strength and power coach at LSU. Just to set the scene, would you be able to just give a bit of an overview on your philosophy when it comes to plyometrics? Then we can kind of dive a little bit deeper into this topic.
Sure. Generally speaking, I think that plyometrics are pretty much an essential part of just about every training program. I think that they are very important as far as skill teaching, as well as the power and elastic strength development that they produce. I think that they are of a huge importance in supplementing the acquisition of speed and strength. I think that plyometric training should be a very high quality, not a quantity-based, but a quality-based approach. I think there are certain types of plyometrics that serve very definite roles in the program, so I think that you have to be organized in that regard. And I guess finally, I think that plyometrics should be very purposeful, meaning that rather than just doing things to do them, I think that it's very important that you have a very distinct targeted purpose each time you put an athlete through some type of plyometric workout. I think that every different type of plyometric has a unique purpose, and I think the key to success there, besides applying some common sense, is the ability to use each type of plyometric as it is intended to be used in the role it's intended for.
When you say skill teaching, what do you mean by that?
Well, I think that we always think of plyometrics as something that makes you explosive and improves your elasticity and so forth. But I do think that plyometrics are tremendous motor educators, and that they teach you how to apply forces to the ground in certain very precise and very particular planes and of movement. So I think that if the plyometric program is appropriately diverse and you hit correct ratios of horizontal to vertical types of work, I think that you see not only strength and speed and power levels increase, but I think that you also see general movement quality increase. I think you see sprint mechanics improve. I think you see change of direction qualities improve dramatically if you hit the right bases in your plyometric program.
So you mentioned that you believe that each plyometric exercise has a purpose. How do you bucket the exercises together to form a menu for you to choose from? So depending on what purpose you have, is a bunch of exercises that you could kind of pick from. Is that how you work?
That's exactly how I work. I'll venture from it occasionally, but for the most part, almost all of my plyometric series and our circuits, exercise groupings, are all pre-assembled, and I select from those different groupings depending upon the purpose of the training session and the time of the year. I typically break plyometrics down into three main categories, I guess you would say. Your in-place jumps are typically done in circuit form, and I have 3 or 4 different circuits that I use depending upon the level of the athlete and the stage of training. And I think that in-place jumps are by far the best way to establish just your plyometric volumes. If you're going to have an athlete who's going to do significant amounts of plyometric work, I'm not a big volume person, but there are some volumes, some basic work capacities that are specific that need to be developed in that regard. And in-place jumps are the best way to do that. If you take a look at in-place jumps, a good circuit might have 10 or 12 different exercises in it. Well, if you have 10 or 12 different exercises, then each of those exercises is stressing the hip, the ankle, the knee in a different way. All those exercises are stressing ligaments and tendons and cartilages and soft tissues in different ways. So you have tremendous diversity there in the way the tissues are being hit. And since the number one cause of injury typically is repetitive movement, because of the fact that you're picking all of these different exercises, you have zero chance of repetitive movement injuries when you use in-place jumps to build your volumes. That's why I think that they are very uniquely suited for that purpose. The second type of basic classification of plyometric I use are what I call short bounds. Short bounds have a technical demand. They can be horizontal or vertical, and their primary purpose is, in addition to the power and elasticity that they develop, these are your skill producers. These are the jumps that actually teach athletes how to apply forces to the ground correctly. They teach the correct timing of the ground contact forces and swinging forces that are involved in jumping activities, and therefore they have the most carryover, in my opinion, to the to skill, more transfer into sports skills probably than any of the others, a lot of the others that we see. The third category is extended bounding. Extended bounding is, they're very similar to short bounds, but they're done over greater distances, 30, 40 meters or so. And these are about power sustenance. For many, many years, extended bounding has always been associated with the triple jump in athletics. But I don't think that's a very good comparison, to be very frank with you. I always think that when you take your triple jumper and are bounding them like 50 meters, that's kind of like running your 100-meter sprint or 800. It just isn't that specific. I think where these exercises really shine, though, is in sports and activities where you have a high power output, but you also have a pseudo endurance demand as well. So I think that they fit really well into the middle distances in track and field, sports like basketball, where you have these 2-minute spurts of play and such. So I think they're very applicable in those situations. And then the final category would be your depth jumps. And your depth jumps, the purpose there is very simple. It's high-end training, very high intensity training for the athletes that are prepared for it, to train power and elasticity at the very highest levels. So in short, that's my taxonomy. I'll sometimes subcategorize a little bit within those, but for the most part, that's kind of how I see the plyometric world and all of the plyometric options you have out there available to you.
Superb. On the short bounds in that category, you mentioned that you can go vertical and horizontal. Is there purposes for each one of those? I know you mentioned you can subcategorize. So would that be a subcategory of that group?
Absolutely. Yes, they are. And I try very hard to maintain certain ratios of vertical to horizontal work. And I find that athletes gravitate toward more effective movement patterns if you work vertical to horizontal at a ratio of about 2 to 1. And I can't really explain why that is. I think it has a lot to do maybe with just human anatomy, and we're kind of we're horizontally oriented creatures, I guess is what you say. If you look at an animal who runs around on all fours and you look at the human hip, there's still some vestiges there of similarity in the anatomy. So maybe it has something to do with the point we are right now in our evolution, but as a species. But that being said, I think that it's much more difficult. Anecdotally, I found that it's much more difficult and takes more effort to develop the vertical qualities as opposed to the horizontal qualities. Now, why you need both is obviously because just about any time you push off of the ground in a jump or a run or throwing or changing direction, there's a horizontal component and a vertical component. And the ability to manage forces in both planes, I think, is very important. For example, if you're accelerating, there's a very large horizontal component as you push against the ground. So in order to enhance that the acceleration mechanics, horizontal multi-jump type of activities are advised. On the other hand, if you look at maximal velocity sprinting, the forces are far more vertically oriented. So vertical abilities, the ability to produce force effectively on a vertical plane, is critical to proper execution at maximal velocity. So that being said, those are just two examples of those skills. And when you start looking at team sports and the changes of directions and all of the different unpatterned acyclic type of movements you see in team sports, then it becomes obvious that you have to be versed in both and be able to combine them at will, so to speak.
So in team sports, say basketball, for example, when you're not going to hit max velocity too many times during a game, would that mean that your practice is more horizontal orientated in terms of plyometrics?
Possibly, but not necessarily so. Like I said, our natural disposition seems to be, just for general movement quality, that we need more vertical work than horizontal. There are times when I may even go beyond the 1-2 horizontal to vertical ratio and maybe go 1-3 or even 1-4 for certain sports and activities. But I typically don't drop below that 1-2 marker. So I feel very strongly about that because I feel that vertical plyometric activities are really helpful when it comes to change of direction. I know they don't really look like it, but I think that the muscle groups that are responsible and effective in change of direction are similar to those that we see used in single leg vertical jumping. And I also feel that if you take a look at like change of direction in team sports, I always see change of direction as a yielding type of activity. And just in my work, whenever I go to programs and I see poor change of direction qualities, I typically see poorly organized plyometric programs. And if you think about it for a second, if you're doing like a box drop jump or a rebound jump off of a box, well, you're changing direction from down to up. Well, at the tissue level, there's really no difference in changing direction from down to up or left to right. It's all about eccentrics. It's all about yielding there. So I think that being effective in the plyometric realm is important in order to be able to change direction effectively. And the vertical plyometrics seem to be the environment where we can teach yielding best.
So another subcategory that I'm just going to mention is single leg plyometrics. Where does that fit in, or does that fit in?
It does fit in, but I find single leg options in all of the different categories I mentioned. I use some simple single leg working in place jump circuits. The short bounds, the majority of those I use are single leg. The extended bounding, and even with super high level athletes, single leg depth jumps might even be something I might tackle. Although I've only had maybe 3 athletes in my whole career that I felt were qualified and prepared to do that type of work. So yeah, single leg work is a big part of what I do, of course, and I do differentiate between single and double leg, but that's kind of in the context of those other taxonomy categories.
So in terms of, you mentioned that the depth jumps, single leg depth jump, those that may fit into that category have been very, very few. In the double leg depth jump category, is that still, do you think people move into that category too early? Is there still quite a low number of people that actually deserve to be in that category?
Well, it's no question that it does require a preparation, and I'm not talking about weeks. I'm talking about months and possibly years in order to do genuine depth jumps. And I want to differentiate. Some people, some coaches will pull out boxes and have athletes bounce on and off of boxes, but that doesn't necessarily make it a depth jump. When I think of depth jumps, I'm thinking of boxes that are very high enough to put an athlete into an environment, a motor environment, an impact environment that they couldn't achieve otherwise. So, for example, let's assume that you have a young lady, and forgive my use of the imperial system, but let's assume that her vertical jump is maybe, let's say, 24 inches. Okay. Well, if you put her on a 12-inch box, or if you put her on a 18-inch box, it's really not that big a deal because she could create those intensities without the presence of the box. But if you put her on, say, a 30-inch box and ask her to fall off and rebound, well, then suddenly you've increased the impact levels to something she could not create ordinarily. So To me, that's the difference between box jumps and dev jumps. And before I get an athlete to genuine dev jumps, they need to be adequately prepared. They need to be invest months and, like I said, possibly even years before I'll do genuine dev jump types of work with them. And then when I do, it's very short and sweet. It's quality based, very low volumes, and it's just like a quick hit type of thing.
So the next guest to feature on this masterclass is Eamon Flanagan. So Eamon is the lead strength and conditioning coach at the Irish Institute of Sport and came on the podcast in episode 99. I was super excited to get him on because he is pretty best well known for his work in VBT and also RSI. So it's RSI that we focus much of this bunch of clips on from Eamon. So discussing the different protocols when it comes to RSI and certain thresholds that Eamon uses and anyone else can use and the benefits of them. But also the daily monitoring using jump protocols, what different protocols we can potentially use and what information we can glean from that. And also how we can quantify plyometrics, the intensity of plyometrics, which I know is a difficult one, but Eamon dives into that as well. So over to Eamon from episode 99. If you haven't checked out episode 99 from Eamon, it's definitely worth a listen. So I just want to get into the chat, and it kind of focuses around what your PhD was, which was the kind of RSI stuff. But I just wanted you to touch on something that I'd spoke to Mark Jarvis about, who I think he's doing his PhD around the quantifying of plyos. So I was wondering if you could just get into a little bit of a chat around the difficulties and the obstacles that comes with when you want to do that.
Yeah, so I guess if we're talking about maybe quantifying plyometric training, I think for me, there's probably two strands to that. And the first is probably, quantifying the mechanical or the neuromuscular intensity of exercises. So quantifying the stress of the jumping or the landing portion of plyometric exercise. And at a simple level, and I work fairly simply, I guess that's probably going to be dependent on, it's going to typically be determined by, I guess, the amount of force involved in the jumping or the landing phase, maybe the time in which that force is applied or that force is absorbed, and maybe the joints, the joints in the body across which that force is maybe dissipated or absorbed, and when we're doing our jumping activities. So I guess if we're thinking about different jumping activities, something like a counter movement jump, a standard vertical jump, in that activity, we might produce a reasonably large total amount of force, but it doesn't necessarily mean it's a high intensity exercise. We might produce a lot of force, we might jump with maximal intensity of effort, but it doesn't necessarily mean it's a high intensity plyometric exercise because we're applying that force over quite a long time period. It might be 0.5 or 0.6 of a second. And also we're generating or absorbing that force across multiple joints. The knee and the hip and the ankle are all contributing pretty extensively to absorbing the force on landing or generating the force on jumping. So if you counter that to your faster plyometric activities like your repeat hurdle jumps with short contact times, or your drop jumps, or your pogo hops, there you've still got reasonably high forces produced, but those forces are now produced or absorbed in very, very, very short time periods. And those activities might be a lot more single joint dominant, might be a lot more ankle dominant. So all of a sudden you've got similar amounts of force applied, more localized to certain joints in much quicker time periods, which probably makes them have a much greater stress on muscle connective tissue and the joints involved. So I think that's a challenge as a coach, is to weigh up what is the relative intensity of the different jumping or plyometric exercises I'm going to use. The second strand to that, I guess, is more of a training transfer question, and it's what is the type or the nature of the plyometric exercise that you're doing, and I guess that's where maybe in some of the stuff I've written or talked about, I've talked a little bit about the slow stretch shortening cycle or the fast stretch shortening cycle, and they're certainly not terms that I coined or came up with in any way. I've just happened to have kind of researched them a little bit and written about them a little bit. So for me, I guess that the main point there is that not all jumping exercises are created equal. I think a mistake I've certainly made in the past, and maybe some younger or less experienced S&C coaches make, is that we tend to kind of lump all jumping related activities in together and term them generically plyometric training. But ultimately, there's probably two very different types of plyometric activity. You've got your more kind of vertical jump height focused training, which is, is more physiologically, is maybe more slow stretch shortening cycle. It tends to be very hip and knee dominant, tends to have very long contraction times, tends to be very jump height focused. And then at the opposite side of that coin, you've maybe got, your fast ground contact focused exercises, what we'd call fast stretch shortening cycle exercises. And they typically have much less flexion at the knee and the hip, typically have very short contraction times, or they involve a distinct ground contact phase that's very short in duration. And they tend to be much more, ankle dominant. And again, they tend to be, I think, much higher intensity plyometric exercises. And if we looked at those fast stretch shortening cycle plyometrics, at one end of the spectrum there, you'd probably have the type of simple skipping and pogo hopping type drills we would do in track training or in warm-up work for the gym. And at the other end of that spectrum, you'd have, I guess, the more traditional Russian shock training methods, where you use very high dropping heights in the drop jump, and you're looking at very intense plyometric exercises that are focused on really quite general physiologic adaptation around, the neuromuscular system and the Golgi tendon organs and things like that. So again, I think in terms of quantifying, you got to think about what's the relative intensity of the plyometric or the jump training in terms of the stress on the muscle and the connective tissue and the joints. And then I think you've got to think about what's the nature or the type of exercise you're using in terms of wanting to transfer that training to sport. Because I think beyond very early general training phases in relatively untrained athletes, I suspect there's probably very limited transfer between your slow and your fast stretch shortening cycle activity. So you can do all the counter movement jumps you want. You can do, as much box jumps as you want. But beyond an initial general training effect, I don't suspect that's going to have much of a positive effect on, the integrity of your foot contact or your fast force application in high speed running.
You just answered my next question, which was about the transfer of the slow and fast stretch shortening cycle activities. So the slow stretch shortening activities would be maybe for general prep stuff and for younger athletes or less well trained athletes.
I think they both can have a place. Okay. I think that's maybe something that I would challenge a little bit. I think both types can have a place in general prep phases and with novice or beginner athletes. I just think with, so in the case of your slow stretch shortening cycle stuff with those novice athletes, you're maybe spending a little bit more time working on the actual mechanics of their jumping and the mechanics of their landing rather than the actual height that they're jumping to. And in terms of the faster activities, the ground contact focused activities, I think they should still be in, novice training programs. Ultimately, those novice athletes, they're still sprinting, they're still hopping and skipping as part of their on-field work or track work or whatever. So I would still include fast stretch shortening cycle activities for them, but, your focus might be a little bit more on lower intensity options where the athlete can focus on, good foot integrity, good foot contact, short contact times, but there's very little focus on, again, the contact times and the jump height, which makes the whole exercise a lot more intense. But, so I think the slow and the fast will have different transfer effects. For sure. I think one is going to, the slow activities or the jump height focus activities are obviously going to have a little bit more of a direct effect on jump height outcomes, and your faster activities are going to have a little bit more of an effect on your activities which are more dependent on fast contact times, ankle dominance, and fast force production.
Mm-hmm. Which brings me on nicely to a couple of, 3 articles that you wrote for Train with Push about RSI. Do you just want to talk to us a little bit about, but it's probably going to touch on what you actually spoke about in the articles, And again, I mean, you talk about you've been talking simply. Please drag it down to my level, and just maybe talk to us a little bit about maybe what you talked about in the first RSI article, and actually what it is and kind of where it fits in.
Yeah, sure. Yeah. So I guess what we talked about already was, how you might quantify the intensity of your plyometric work. And, you mentioned people there who might be doing PhD work in this area. And I think to quantify those plyometric exercises very precisely, you've got to be looking at the video, you've got to be looking at the joint angles, you've got to be using your force plates. If you really want to nail down what the true intensity of those exercises are. Ultimately, not many of us have access to those tools in the practical domain that we work in. So I think in that instance, I think it's not a perfect fit, but the reactive strength index can be a simple objective tool to guide us towards kind of optimizing that fast stretch shortening cycle training, or to guide us or to help us understand the intensity of our plyometric work. So all the reactive strength index is, it's a simple measure that you would use in drop jumps or hurdle jumps or hurdle hops, repeated pogo hops, and it looks at how high you jump divided by your ground contact time. So if I was doing a drop jump and I got off the ground in 150 milliseconds and I jumped 30 centimeters, I'd divide the jump height by the contact time and I'd get a reactive strength score of two arbitrary units, or 2 meters per second. So that's kind of how you would calculate it. And I guess now the ability or the possibilities of measuring that within your training is becoming much more widely available. You can do it with, a jump mat that might cost you a few hundred quid. You can do it with timing systems like OptoJump, which are a little bit more expensive, but very accurate, very reliable. And now you can potentially do it with wearable technology like the push band, which is beginning to incorporate things like the reactive strength index into some of its protocols. So that's kind of what it is. And I guess, why I like it is that it's giving you that little bit of information about how high you're jumping, how fast you're jumping, and the trade-off between the two. And it's been shown to be a reasonably reliable and a reasonably kind of sensitive measure. So once you can measure it, it allows you, if you want to optimize your plyometric training, it allows you to potentially play around with different box heights in your drop jumps to possibly identify heights that may be a little bit too low or a little bit too high for the athlete, because you're seeing their reactive strength scores, drop off a cliff. Over time, it's potentially a tool you could use to identify your athlete's chronic adaptation to a plyometric training program that you might be implementing. And I know we'll talk maybe a little bit later about how you could potentially use it as a monitoring tool or a readiness to train tool as well.
So one thing when we were back and forth with the kind of stuff that we're going to chat about, you mentioned about single leg testing options, and that's something that often gets asked of you when it comes to this kind of thing. So I just want to touch on, maybe answer them questions.
I kind of forgot you were going to ask me that. So the simple answer to that is I don't have a good answer to that question. So I think for the most part, what we've been talking about so far has been your slow and your fast stretch shortening exercises, and they've been exercises like counter movement jumps, box jumps. They've been exercises like drop jumps, repeat hops on the spot like pogo hops. And obviously all those exercises I've mentioned, they're all bilateral, they're all vertical force production. And we know that obviously so much of the activity we do is a little bit more horizontally focused, or can be a bit more horizontally focused. And obviously any locomotion we do is very much single leg focused. So naturally the question then is, well, do we need to be testing reactive strength more horizontally, or do we need to be testing it in a single leg condition? And I think the simple answer to those two questions is, ideally, it'd be nice to look at this both vertically and horizontally, and both bilaterally and in the single leg option. But I can't. I can sit here and tell you some simple and effective ways to test vertical bilateral reactive strength, and I've outlined a lot of those in the Train with Push article series. But I probably can't sit here and tell you I've got a gold standard for the single leg horizontal focused reactive strength testing. I think the general trade-off with double versus single leg activity is going to be that, there's always going to be a trade-off when we're measuring anything. There's always going to be a trade-off, I think, between experimental control and training or testing specificity. So obviously with something like a vertical drop jump, we've got really good control. We can control the box height really well. Athletes tend to be able to get the technique of the exercise pretty quickly, and the results we get tend to be, fairly tightly clustered together. Your variability from rep to rep is within probably 5%. So what we have there is we've got really good experimental control, but potentially we've got a little bit lower specificity. If you're looking for that horizontal single leg option, now we're pushing more towards that specificity side of things. But from my experience, once you go to that single leg option, the reliability gets a little bit noisier, the data gets a little bit harder to collect, and so I think you lose a little bit of that experimental control when you get after the specificity. But that doesn't, just because we can't measure it as well as we can measure the general training, doesn't mean that that's not an avenue that's worth exploring. And I know there's a lot of good researchers out there doing more work in that area than I am. And I think James Wild, for example, who you've had in the podcast before, I think he's doing some pretty good work in that area. So he might be the one who really nails down a nice, robust, horizontal, single leg reactive strength test. And that's me firmly passing the buck to somebody else there.
Yeah, a fellow passing the buck to a fellow ginger for me. Yeah, he was great. Yeah, it was great to have on was James. So just about, you touched on it and said we would talk about it in a while. So I'll kind of bring it back to the daily monitoring, and maybe this goes into probably touching on parts 2 and 3 for the RSI articles. But it was just where does RSI fit into the bigger daily monitoring in picture for people?
Yeah, so I guess, like I said already, I think there's 3 simple applications to using the reactive strength index. And one is just using it acutely to try and optimize the plyometric intensity of your exercise, changing the box height on your drop jumps, as an example. The other way is, maybe using it as a quarterly or monthly or weekly test to look at the chronic adaptation to plyometric training and the chronic adaptation to reactive strength training. But you could potentially use that same data as a daily or as a weekly readiness to train type metric. So the obvious question there is, why would you use something like the reactive strength index rather than the counter movement jump, which I think if we were having this conversation 5 or 6 years ago, I think more people were probably using a standard counter movement jump for height as their weekly monitoring tool. And I guess when you're using something as simple as a jump height, which is output focused only, you potentially miss part of the picture when fatigue gets involved. So Stuart Cormack, for example, did incredible work in this area. Back in, I think, 2007, 2008, around that time in AFL, and he looked at different jump tests across an entire AFL season. And I think what he showed pretty clearly was that if you just look at jump height, athletes can potentially recruit different jump strategies to maintain the same jump height over time. So if I'm under fatigue, if I usually jump 50 centimeters in a counter movement jump and I'm under fatigue, I'll find a way to still jump 48 or 49 centimeters, maybe even 50 centimeters, but I might spend longer in the eccentric phase. I might spend longer in the transition phase from eccentric to concentric. I might go through greater hip and knee flexion in order to generate the force I need to jump 48, 49, 50 centimeters. And I think what Stuart Cormack did was he continued using a counter movement jump, but I guess using a force plate, he was able to look at how does that jump height relate to the time it takes me to produce the jump. So, how long does it take me to go through the eccentric and concentric phase? That's basically my contact time and my contraction time. And how does that relate to the jump height I jumped to? And he found that was a much more sensitive measure to fatigue over, an arduous week-on-week season. And so that's where the reactive strength index potentially adds some value as a marker of neuromuscular fatigue. It's not just looking at jump height, it's looking at the contact time as well, and it's looking at them in relation to each other. So, again, if I'm on my good days, if I'm jumping 30 centimeters and I'm getting off the ground in 150 milliseconds, as I go through a period of the season, I become fatigued. I may maintain that jump height at 30 centimeters, but my contact time might creep out to 160 milliseconds, 170 milliseconds, 190 milliseconds. So we'll see quite a noticeable, measurable difference in the reactive strength index on that basis, because, I'm maintaining jump height, but I'm doing it in a different way. I'm recruiting a different strategy to achieve the same outcome. So I think because of that, the reactive strength index is potentially a more sensitive tool to try and assess that fitness fatigue model when we're looking at our athletes.
So is there specific thresholds that you would say is not thresholds, but say take the example of the 30 centimeter jump and 150 milliseconds. At what point are you changing things in the up and coming training session? Are you letting it go to 0.1 or what would that look like?
Yeah, I mean, I guess what I would probably say here that I wouldn't sit here and tell you I would set a percentage cutoff point for somebody's program intervention. I think the way I would try and look to do that type of work is to really take every athlete as an individual. So every athlete's going to have different amounts of variability from trial to trial. So, I might, have 2% variability on my 3 drop jump tests. Another athlete might have 6% variability. And that just might be our usual variability. So I think the best approach is, you're certainly going to need a group of athletes who are familiar with fast plyometric training, who are familiar with drop jumps and have had a habituation period. And you probably are going to need to have that habituation period be a number of weeks, a number of testing sessions. But, it can be worked into warm-up type activities or general readiness to train type activities. And then I think after that, you're really looking at establishing each individual's baseline, knowing what their kind of normal variation is from rep to rep or from week to week. And then using that data, I guess, to set individual thresholds, using something like a, smallest worthwhile change or an effect size type approach that might give you the option of having, your green, amber, red traffic light system. So if I was to work with a group right now, the general standard I'd probably use might be, looking at a moderate effect size, which tends to be 0.6 of a standard deviation. That might be like my amber zone, where I'm going to pay a little bit of attention to the decline in performance. And, a standard deviation or a 1.2 standard deviations, a large effect size, that's probably what I'm going to have as my red flag. So when that athlete is, a full standard deviation below, the baseline we've established, that's maybe where we're looking at possibly having some kind of intervention. But, we spoke a little bit previously, Rob, about, for me, you got to have your baselines, you got to establish individual thresholds. But for me, the biggest part of the monitoring process, whether it's RSI or any monitoring tool we use, for me, it's the context, and the context specifically the context of that individual athlete. And I guess what I mean by that is, as S&C coaches now, we're in this era of big data. If you take something like, I don't know, I guess, the simplest monitoring tool we've got is probably training time and RPE to give us a training load. Simplest, most widely available, cheapest tool we've got. And if you even just take that tool alone, out of those two numbers, our training time and our RPE, we can get training load, training monotony, training strain. We can get the training stress balance that Tim Gabbett's published a lot on. We can get, weekly change in terms of percentages. We can get a percentage breakdown of how much training load we've spent in S&C, sports specific, speed, conditioning, etc. Even just that simple method can bombard us with information. So, and that's not to mention before we get into musculoskeletal screens, reactive strength testing, HRV, GPS, whatever monitoring tools we're using. So I think for me, context is really important. And that the context for me is framed by an understanding for each of our athletes of what the big established kind of risk factors are. So we know reasonably strongly that, stronger athletes are going to recover a little bit quicker from game to game. Tim Gabbett's done some work in that area. We know that athletes who are better conditioned are going to recover more effectively from game to game and will tolerate the demands of training more effectively. We know that strength has a protective effect in terms of injury. We know that, injury history is probably one of the best predictive factors around future injury. A lot of the work that's been done by UEFA on their big epidemiological studies in football would show us that, we know when there's short time periods from game to game, or players' game time is poorly managed and they accumulate quite a lot of game time acutely, we know that that's an injury risk factor. And I think most of us working in strength and conditioning would also probably know intuitively or through experience that those athletes with their really explosive, fast twitch, speed profiles, we know that they tend to need a little bit more managing and tend to be a little bit more exposed to acute injury incidences as well. So I told you I'd go off on a tangent, so here it is. So for me, I guess the point is, I would always look at those factors first. So I'd look at my athletes, especially in the team sport environment where you might be managing 30, 35, even 50 athletes week on week. And I'd try and identify who are the ones who are strong, who are the ones who are well conditioned or poorly conditioned, who are the explosive guys, who are the workhorses, who are the guys with extensive injury histories, who are not. And that for me would inform any decision I'm making on something like my monitoring tests or my reactive strength tests week on week. If I've got a guy who's really strong, very well conditioned, keeps himself in good condition, has a very clean injury history, and if I've got a guy like that and he's in that red zone for reactive strength index, I'm going to be much less inclined to make any intervention. Because for me, that athlete over time, the whole point of him doing all that training, the whole point of him getting stronger, getting more fit, keeping himself lean, keeping himself fit and healthy, the whole point of that 10 years that he's put in is so that he can get through these periods of fatigue relatively unscathed. If I'm dealing with a guy who's, not as strong compared to his peers, especially in the contact sport, who's not well conditioned, but who may still be very explosive, who maybe has an extensive injury history, when I'm seeing those red flags in the wellness scores or the reactive strength testing or the training load or the training stress balance metrics, that's where I'm probably going to be a lot more likely to intervene or to go to the head coach and try and promote an intervention in that case. I guess for me, it's a little bit like, if we're not looking at those big risk factors first, it's a bit like trying to look for advanced screens for coronary heart disease before you've even asked the patient whether they smoke or not, Yeah. I just think we've got to take the big picture into account and use that to inform how we action the monitoring data.
So this next short clip comes from Lachlan Wilmot, and Lachlan has recently made a transition away from the Parramatta Eels, where he was high performance manager, to set up his own gym in Sydney, which is Athletes Authority. So you've probably heard of Lachlan. He came on in episode 185, but also episode 77. And in these podcasts, he discussed using plyometrics in a rehab setting, how he progresses jumping activities during return to play. So it's this that we feature in this masterclass. So it's only a short 4 or 5 minute clip, and it's the only one that comes from Lachlan because there was such a bunch of other things that we chatted about in these episodes. But it's a really interesting one. It's something that's probably not discussed too much. So I was really pleased to get it in there and offer something a little bit different for when it comes to using plyos and jumps in a rehab setting. So over to Lachlan. So just want to touch on, again, something that you've probably mentioned already, which was regards to the rehab and
yes.
Your use of jumps and plyos. Firstly, in the guys that are fit and playing compared to how you use it in kind of end stage rehab.
Yeah, definitely. So as a strength coach, I'm a pretty big proponent of plyometric and jump work. I definitely believe there's a big difference between jumps and plyometrics. I'm a bit old school in the view that plyometrics are exceptionally explosive. I think a lot of people that call things plyometrics, they're actually just jumps. So we definitely try and add in a combination of high-end plyometric work, but also your standard jump landing mechanic work. And in particular, we have a really good focus, and one of the best focus that I've seen around in the return to play structure. So Luke Heath, our head of rehab, he's been really strong in exit criteria for our boys. In fact, if you ask the boys, he's probably a bit of a Nazi with it, but he has very strong, very objective measures that he wants to see for his players when they're returning, whether that be ACL in worst case scenario or things like a simple, grade 1, grade 2 ankle sprain, whatever it might be. And amongst some force measures and some symmetry measures, he also uses a couple of hop for distance and a little bit of plyo measures that allows the boys to be a little bit more of that explosive side. And we also have a big selling point on, you might be pain-free, you might be strong enough, and you might be able to train, but are you ready to perform? So a big philosophy with our return to play is not just, it's not just return to play, it's also return to performance. So we set some pretty strong targets from a strength point of view, from an explosive point of view, and then also from the physio realm, which would be along, low-level strength measures, symmetry, and then range of motion work. And these boys are presented all of this at the beginning of their rehab, so they know exactly where they're going with it. And we have quite a big focus at the end stage when Mick Byers, our strength rehab coach, takes a lot more control of them, which is usually when they're starting to be introduced back into training. He'll have them in the gym and be working really closely with them along A, big strength movements, but B, a lot of their jumping mechanics, landing mechanics, and plyo work. So we have definitely been big proponents of trying to make sure that the plyometric work included into their return to play, because I think a lot of time it's missed out on, and it's not necessarily missed out on because people forget about it, but I think it's once a player gets back into training, and especially when they start to become available for games, this hyper focus of their development, whether it be, let's say an ACL, if someone's suddenly available to play after they've had an ACL injury, they tend to drop a lot of the things that they probably should be doing that are going to increase their performance, but also decrease their risk of another ACL. And often that's going to be your explosive stuff, because you obviously are going to be quite fatigued after playing games, and jumping around is probably the last thing you want to do. So I think us starting some low-level landing mechanics quite early in our rehabilitation program has been really beneficial, because it means that as they get into the end of it, they're really doing some quite high-end plyo work that are going to set them up for some really good rate of force development actions on the field, but also their ability to change direction, their ability to be able to decelerate and accelerate. I think it all contributes quite nicely to mix it all in to make sure that they're as confident as they can be when they return. So like I've talked about before on Twitter, I think just being able to have that plyometric component and making it a major part of their end stage rehab, I think is very important.
So I'm diving right back into the archives for this one. It's with Mark Jarvis, who is now at Southampton Football Club, but at the time was at the English Institute of Sport. And this comes from episode number 38. So massive apologies for the graininess of the audio, but also potentially my rambling of questioning. It's really interesting going through these episodes and seeing how I put the questions to these guys. And I hope I've got better, but apologies for the rambling at the start of the questioning to Mark. But in this episode, we discuss plyometrics as team sports and endurance athletes, because Mark has got a book where he discusses this for endurance athletes, but that isn't included in this masterclass. However, the plyometrics for team sports is, and also about quantifying plyometrics, which is kind of what Eamon touched on, but we get a little bit of a different take in this. So over to Mark from episode 38. Again, apologies for the graininess of the audio, but hopefully it's really worthwhile. So I just want to kind of move it on to something else that I put to you the other day, which is plyometrics, which is something that you're obviously working on at the minute. But just tapping into your kind of background in team sports, maybe with football as the main one. Talk us through your kind of thoughts on plyometrics and in team sports, and the kind of the experiences you've had and how you progress them, how you regress them.
Okay. I think sometimes I don't want to use the word expert here because that doesn't sound particularly modest, but when you start to develop an expertise in an area, unfortunately it means that you tend to recognize the limitations of that area more and more, and therefore you use it less and less. And there's a great quote in Super Training, something along the lines of, one of the mistakes of proponents of plyometric training is that they often fail to recognize that there may be sufficient plyometric activity in the training program already. Something along those lines, and I think that's very true of team sports and football. So for me, I think if you look at the activity, if we take a broad view of what plyometrics is, and, it's not just jumping off boxes and bounding in a very confined environment, and it's my definition of plyometrics would be anything which overloads the stretch shortening cycle over and above what you normally do. So what you need to do to overload that for a triathlete is clearly very different to a triple jumper, for example, and that sort of leads to why those methods might be quite different. So for team sports, where is that stretch shortening cycle going to be challenged? Obviously, that's going to be at high velocity sprinting, changes of direction through longer stretch shortening cycles, various sort of jump challenges, primarily unilateral, etc., etc. So those are the stretch shortening cycle actions that we would seek to overload. And I think by clever drill construction and good monitoring of training, you can actually achieve all of those quite nicely without actually, quote unquote, doing plyometrics. And I ran a very small pilot study with a few young players once. I took them down the track and where we've got the force plates embedded, and I got them to do some sort of standard classic plyometric exercises, and I got them to do some of the sort of football actions that we just described. And what was really interesting is a couple of the plyometric actions, the impact spike when they landed was slightly higher, but for the most part, certainly the propulsive component, including the eccentric phase, so that's an active braking rather than a passive landing. The curve was almost exactly the same for the footballing actions as it was for the plyometric actions. And therefore, my view on that would be the idea of plyometrics outside of track and field, in general, is that you're sacrificing some degree of specificity because you're performing movements slightly different to those performed in the game, but the trade-off is that you gain intensity. But if you look at that from the evidence that I've collected there, you haven't gained any intensity, and so you've traded your specificity with nothing in reward, nothing in return. And so you're probably better off just doing the actions. Allied to that, you've also got the fact that those players are probably going to be significantly more engaged. If you keep putting crosses into the box, for example, so one of the exercises we asked them to do was run in and then just leap naturally as they would do to finish a header, which was pretty much the same as a bound in terms of the force curve. So you can probably get away with doing that for quite a long time with a reasonable level of engagement and motivation because they want to get to the ball. Whereas asking them to do the same thing in a dry setting of just continually bounding, and they're not necessarily going to see the relevance, you might start to struggle. So I think if you can control those things and understand the plyometric volume, I don't necessarily think that you need to add a great deal in there, certainly not in terms of performance enhancement. Where I've probably used plyometrics more frequently would be in low-level prehab rehab settings, where I don't think it's used as effectively as it could be.
Mm-hmm. So I was gonna ask you something then, but I'll ask you that at the end. So how do you think that could be used more effectively from your point of view?
What
from the rehab prehab stuff.
Okay, I'm generalizing here and speaking quite a lot from my own specific experience. But with that caveat, there's seems to be a massive amount of unstable surface training that goes on within football, particularly with regard to ankles. And I've had this debate with a lot of physios, and there were some great physios that I worked with at West Brom. We had some fantastic debate. And one physio in particular kind of agreed with me, the whole debate about feedback versus feed forward mechanism of when you land on the ground. So obviously if you're on an unstable surface, you're relying on a feedback mechanism to tell you where your foot and ankle are and then correct it, as opposed to in a real life situation where you'd have to pre-activate in a feed forward mechanism. And so fundamentally, the motor pattern that you're developing is fundamentally different. So that was my sort of theoretical argument against doing lots of unstable surface work. But I had another guy there who agreed with me in theory, but found that he just got worse results when he took that stuff out and just kept it in. And therefore we kind of both came to the conclusion that actually a little bit of both, and the increase in activity that you're going to get around the ankle stabilizers is probably worthwhile, even though it's non-specific, and so the combination come together. But I think if I hadn't added in a lot of low-level plyo stuff, the balance would have been skewed. Another thing that I found hugely useful was clearly knee pain is pretty common in football. frighteningly now the amount of volume that they play in academies when they're younger. You're getting more and more lads with osteochondral defects and patellar tendon issues at a young age. And I found that they get caught in a vicious cycle quite often, whereby they start to get a little bit of quad inhibition through patellar tendon pain, which then leads them to get into more disadvantageous positions, so that the knee will start to glide forward, thus placing greater strain on the patellar tendon and more damage, more pain, more inhibition, etc., etc., and so it goes on. And so by introducing some really nicely controlled low-level plyometrics to kind of overcome that inhibition, to have like a disinhibitory effect prior to going out training, they then don't get into those positions, they don't accumulate the damage, etc., etc.
So I'll just go back to what I was going to ask with the crossing and finishing. That's quite interesting to me. So traditionally, you do plyos in the gym, and then all of a sudden you're saying, okay, we're not going to do that in there. We're gonna go outside and we're gonna do something that traditionally a finishing coach or a technical coach would normally do. What was there any conflict there? Did you how did you work that?
I don't think you even need to do them separately, to be honest with you, Rob. I think if you with the amount of GPS or not just GPS, accelerometer monitoring that players have typically now, or even if you're working at a lower level and you don't have that, you can just count stuff to some extent, although that does present a bit of a challenge. But I don't think you need to necessarily even put on a special session. You might be doing small-sided gains and go, okay, well, how many changes of direction over a certain threshold does a player carry out? How many sprints over a certain velocity do they carry out? And you can start to accumulate a plyometric load without it ever being anything other than the normal session. And the other thing, a physio who's now in Australia that I used to work with, a guy called Mark Young, came out with a simple but brilliant quote before about what he thought S&C should look like, and that was just give them what they don't already get. And I think that there's huge value in that.
Yeah, I like that.
Trying to do more of the stuff that already exists in football. It's like, well, they've already got that, and similar to the plyometrics example, really, like they're already doing that, but it's better because it's actually football. So don't just inject a watered down version of that. Give them something discrete or distinct that they don't already get. High duration contractions with high protein synthesis, low protein degradation strength training, which is not the kind of muscle stimulus that you're going to get playing football, is probably of quite a lot of value. And if you look at, I always refer to the work of Cormy from, sort of 4 or 5 years ago, looking at do we go down a strength bias or do we go down a power bias? Most of these people, or the majority of these players, are effectively doing some form of power training every day because it's an aggressive, high-intensity sport. What they aren't doing is any kind of strength training. And so that's the gaping black hole. And so the way I look at it is, if you just did a study and you only did strength training, it probably wouldn't have a great effect on your football performance. But the fact that you're combining that strength training with football, you kind of can get, the way I see it, you can give them a fairly general stimulus in the gym, and then they go out on the training pitch and they kind of turn it into football. If you do nothing more than just give them some more satellite cells and they go out and it helps them get better that way. I don't think you have to be too clever in terms of the conversion.
So the next guest to feature on the Plyometrics and Jump Training Masterclass is Jeremy Shepherd. And Jeremy came on in episode 103. And I actually remember getting up for this at 1 o'clock in the morning to speak to Jeremy, because that was the only time that he could do, given that he was in Canada. And I got up and was absolutely blown away by his energy, his enthusiasm, and that very, very quickly woke me up. And it was a superb chat with Jeremy. So towards the end of the chat, we discussed monitoring and manipulating training load, but also managing jumping in jumping sports. So some of the dude sports that Jeremy works with, I used to work with, surfing, snowboarding, etc. And also volleyball, which was a big sport that Jeremy's worked with, if you've read any of his research. So over to Jeremy for this episode. He featured in episode 28, which is very early on, but also where these clips come from, which is 103. So definitely check them out if you haven't already. Jeremy's an absolute legend. His energy and enthusiasm are worth a listen just for themselves. So over to Jeremy. So getting on to a bit of the training chat and just reviewing a little bit what we discussed 18 months ago.
Yeah.
And you've obviously worked extensively with volleyball athletes and athletes that are probably jumping hundreds of times a day.
Yep.
How does training for someone like that in the kind of jumping and landing element of their training, how does that differ to someone like a snowboarder? Obviously, you've got maybe someone doing tricks and that kind of thing. How does their training differ from doing jumping, landing training between the two?
Yeah, really good point. Yeah, absolutely. So what you're sort of talking about here is where jumping in the sport of volleyball is really, really high volume, whereas jumping as a training method for surfers and snowboarders can be directly related to the performance in their sport.
Yeah.
So whereas jumping in volleyball is the number one performance indicator of the sport. So if you jump higher, you will be a better volleyball player. It's literally as simple as that. And I've had volleyball coaches really question that, and I'm like, really? Okay, let's get into it. So you jump higher, you can block better because you're taking up more space. So they have to then hit around you. They definitely can't hit over you if you have a superior jump. But also when you jump in volleyball on the attack, you have more options because you can hit over people, you can hit off the block. And if that goes out of bounds and doesn't get retrieved, that's a point. You can hit it down cleanly. You've just got way more angles. It's just the way it is. So most people are just going to go, well, yeah, jumping. But then you think, well, jumping for a surfer, well, what does that have to do with anything? We've already published a study on that. Josh Seckham was the lead author. Josh did part of his PhD on this, where, and he's a dyed-in-the-wool strength coach, but he did a PhD in S&C on surfing, and we discovered that the rating that you get for your turning ability is related to your lower body power. And then what, through a vertical jump, but then what underpins that is actually your maximal strength. So even though you say, well, what does max strength have to do with surfing? Well, it has to do with your power production in the jump, which has to do with your surfing performance. But you're not gaining much jumping development in surfing, even though you're doing airs and you're doing turns. So it's almost like the jump training that a surfer and snowboarder might do will impact upon their slope style performance in snowboarding, or it'll impact upon their turn and aerial performance in surfing, but the sport won't develop it itself. In volleyball, the sport actually will develop the jump. So the difference in training is you're using jumps to develop the sport in snowboarding and surfing. In volleyball, you're using specific jumps to develop specific aspects related to jumping performance in volleyball. Because as you touched on, they're jumping hundreds of times a day. I mean, a high volume for a middle blocker who's the heaviest athlete on the court, those guys would be doing between 2,500 and 5,000 jumps a week. So giving them more of that is, like going out in a hurricane and bringing a blow dryer and seeing if you're going to blow the hurricane away from you. Like, I'm just protecting me. Turn on a blow dryer. Like, it's useless, right? So to add 20 jumps a workout of counter movement jumps or block jumps is nonsensical. And we've studied the crap out of that. Like, our control groups in all our volleyball studies were always just doing counter movement jumps, and nothing ever happened because they already do thousands of them per week. But if you give them very specific jumps that are based on a detailed profile of which neuromuscular aspects they're lacking in, you will actually have this, it's this uniqueness of that jump style. So it might be a depth jump or an eccentric, accentuated jump as another example, or a loaded jump, or things like that based on detailed testing. That'll be the key thing for them. But the other thing too is in managing total load is in a jumping and landing sport like volleyball, you have got to know how much they're jumping. You have to figure that out, even if you're guessing. So we use microsensors for that, and we validated the Vert device recently as a pretty bloody good one,
Okay.
which was bittersweet because I spent 9 years trying to work with math guys and computer dudes and stuff to build the first volleyball one, right? And we never quite got it right, and then we just bought these ones off the shelf, and turns out they were good. It's really sort of bittersweet. We're like, where were you 9 years ago when I really was angry about counting vertical jumps with my little thumb counter and getting interns to write it down on a piece of paper following 18 national team volleyball players. But yeah, you've just got to know, just like a surfer, you got to know how much they're surfing. With a slopestyle athlete, you got to know how many times they're falling out of a sky from a 90-foot jump and landing with, I don't know, 18 times body weight or whatever the heck it is. You just got to know how much they're doing that to themselves. In a volleyball setting, you just have to know. If you want to do a real good job, you got to know how much they're doing it, and you got to know how to look at that acute and chronic training load.
So, do you want to talk to us a little bit about that profiling process that you talked about to know exactly where that athlete needs to focus that specific jump training?
Sure. I think there's a lot of people doing a lot of really good work, and I don't think there's a one size fits all. So, my thoughts today might be influenced by something that I've worked on last week or something that I used to do 10 years ago. So I just sort of want to preface that as I sometimes hear people, I'm going to say not so much on your podcast, but sometimes I hear people
They can be.
are
I won't hate you. Don't worry.
they're fused to their idea. And it's like, whoa, are you reflecting? Because if you're not reflecting, then you're not chameleon. If you're careful about being fused to an idea. So for me, this is, just a concept. Let's say the setting is a volleyball player. One thing I would consider doing would be to look at a depth jump versus a counter movement jump and an approach jump. So the counter movement jump reflects their block jump in general, because their block jump, maybe with a two-hand reach and all that kind of stuff, but it's really strongly reflected by simply just a counter movement jump and reach. And they also have to do that to say joust, which is a type of offensive slash defensive movement. So a counter movement jump is literally like, how high can you reach the ball when you have to joust, when the ball is interplay between the net. But it also literally strongly reflects exactly what their block jump is going to look like. So I do that one, and that's their normal jump. Then they'd have an approach jump, which is like an attack jump. And then you compare the two. How much greater distance are they getting with an attack jump, with a 3 or 4 step run up? And that gives you an indication of their stretch load tolerance, their ability to transfer the horizontal into vertical. But it is also reflecting technique in that attack jump. Then what I'd look at is the depth jump. And I would go pretty deep, and I would look at several different heights of the depth jump. So 20 centimeters, 30, 40, 50, 60, 70, 80 with an elite level athlete. So how high are they getting off that? And then you can profile where their better jumps are. And this might be called their optimal drop jump height, or the height where they get the best jump whilst dropping. And this reflects their stretch shortening cycle ability in terms of a high stretch load tolerance, because they have to drop from that box and then very quickly get off the ground in order to use that extra velocity in coming into the ground. So if an athlete, say, has a better counter movement jump than any of their depth jumps, it strongly suggests that that's something that's totally underdeveloped. And it could be that it's underdeveloped just because they're piss weak. So they drop. That's a scientific term, by the way, from Australia, now being used in Canada. So the piss weak athlete falls off the box, and their body just goes, holy crap, I can't handle that. You just made me drop off a box, and I just don't even have the structure to handle that. So it's not just as simple as, your counter movement jump is okay. It's 320 centimeters maximum reach, obviously not relative. And then you drop off a box and it's 310. Okay, got to give them depth jumps. It's not as simple as that. But let's say their strength tests demonstrate that you're thinking as a coach, you're like, I see the nuance here. They're strong, but they're not able to transfer that into under a high stretch load. So depth jumps could be very useful for that athlete. Another option as well could be using accentuated eccentric loads where they do a counter movement jump, but they drop the extra weight. So they can just hold dumbbells or sandbags or kettlebells or whatever you want. And they drop the extra weight and then they jump up onto the box. And that creates an acute increase in power of between 6 and 10%. We found chronically over a training study, you could typically expect a 6 or 7% improvement with an elite level population. You could see that as early as 5 weeks in some athletes. Some athletes, it would take 10 weeks to get that 6 or 7% improvement. Just bearing in mind, though, that with those kind of populations I'm referring to, 6 to 7% improvement is a personal best for everyone that you're talking about. So it's pretty profound if you just introduce that unique exercise. You may find that their approach jump is not very good compared to their counter movement jumps. So their run up jump, and it could be a basketball player, a volleyball player. It's not very good, but they have great depth jumping ability. I would say have a closer look at their technique in the approach jump. Could be more of a technique aspect. Because when you run up in approach jump, it's not the same as a depth jump, but the underpinning neuromuscular aspects are similar in that you have to basically absorb the force, use that, have a efficient amortization phase, and then provide propulsion from the horizontal into the upwards. So it's not the same kinematics, but there are similar neuromuscular aspects, neurogenic aspects to it. Other ones, of course, like years ago, I would muck around with a million different loaded jump squats. I don't put my time into that anymore. But one thing you could do is simply use an isometric mid-thigh pull, compare it to a squat jump or a jump squat without load, and then create a ratio on the force. If your squat jump force is 1,400 newtons, and your isometric mid-thigh pull is 2,000 newtons, you're utilizing a fair proportion of your max strength capabilities in your jump. It probably suggests that your next improvement is probably going to come from just getting stronger. Because 2,000 newtons for a 40-kilo athlete is pretty good. But if you're a 95-kilo volleyball player, and you're using 70% of your force capability in a dynamic movement compared to your maximum, and your maximum's only 2,000 newtons, probably suggests that there's some work to be done, that gains to be made on getting stronger. But again, like I said about the depth jump, it's not black and white, and that's the lovely thing about it. It's nuance. We don't lead by spreadsheets. We don't coach by spreadsheets. You get involved in the nuance. The science and the number crunching and the data collection helps inform your coaching. It helps legitimize your coaching. Some people get into coaching to legitimize their sports science. That's never been my path. My path has always been you get into sports science to legitimize and strengthen your coaching and to give you another sort of option. So, you might be really happy with some of their lifts and the way they move, and you're like, yeah, the mid-thigh pull is strong. This isn't. Maybe you don't even like that test. That's cool. Maybe you love jump squats. In which case, I'd say, okay, well, how about an unloaded jump squat and a 50% of body weight jump squat and 100% of body weight jump squat, and then you can look at the ratios there. So if your jump height at 50% of body weight. So you're a 100-gram volleyball player, and you're, let's say, to keep the numbers really simple for the listeners, well, actually more for me, but the unloaded jump squat, you get 100 centimeters off the ground. That's pretty incredible without an arm swing. But you got a towel on your back, 100 centimeters center of mass displacement. Holy cow, we got an alpha Formula One here, right? Alpha male Formula One. 100 centimeters off the ground. You put 50% of their body weight on the bar, 50 kilograms. They do the same jump, and they jump 45 centimeters. So they're at 45% when you add 50% load. And then you put 100 kilos on their back, and they're at 20%. They jump 20 centimeters. to me, from my experience and from research I read in alpine ski in Europe, who originally started doing this stuff, and I boarded off them some older work. I think some of this stuff, even Schmidt-Bleicher might have played around with it. I think it might have even predated his time at Leipzig, in the training center there when it was formerly two Germanys. You've really got a strong indication that athlete is your alpha male. They are the Formula One, but they're currently, could really benefit from just getting structurally stronger. Because you might sort of be more comfortable with ratios of, say, half your body weight somewhere plus or minus 10% should be about 65%, and 100% of your body weight, with some nuance and variation, 35%. But as Dan said on of their unloaded. But as Dan said on his recent podcast, he was a little bit gun shy about giving specific numbers. I'm saying, hold on. Don't forget the nuance, right? This isn't black and white. There's always nuance. Like, hey, this guy's got a great squat, but it looks a lot like a deadlift and their ankle doesn't move. Hey, that's coaching, man. Get after that. Clear that ankle so that their squat actually looks like a squat and their deadlift looks like a deadlift. Or, I don't do deadlifts. Well, good for you. Like, it's all good, man. It's all good. People were winning gold medals and running fast and jumping high long before you and I were even born. So it's all good. These are just numbers that are nice reference points. Don't coach from a spreadsheet. The spreadsheet talks to the coach. The coach talks to the athlete, So just some options anyways.
So the next guest to feature on this star-studded masterclass on plyometrics and jump training is Dave Hamilton. So since I've spoke to Dave in the first episode, which I reference in these next couple of clips, he's moved from USA Field Hockey to Penn State University and then onto the Tampa Bay Buccaneers as Director of Sports Performance. So really interesting chat with Dave, where we chat around RSI. And it's in these clips that Dave gives a bit of a history lesson of where he started out using RSI at the English Institute of Sport and how that's progressed to what he used at Penn State with hundreds and hundreds of athletes, and then now how he's progressed that to what he used at Tampa Bay Buccaneers. So really interesting chat with Dave, which features in episode 282, which I'd highly recommend checking out. So over to Dave. Mm-hmm. So I think we spoke about this 4 or 5 years ago when we had our first chat, but RSI, and again we spoke off air about where that journey came from and your interest in that area and how it's been able to influence your practice. Would you be able to give us that? I know you're just saying the same thing again from what we chatted about before, but it was really interesting. So if you could just tell us the journey about your interest in RSI and how that's helped along the way, that'd be great.
Yeah, I'll try. But generally, when I say thing a second time, it's not as good as the first. But,
don't say that.
Right, here we go. So I first came across it when I was at the English Institute of Sport in 2003, and Adam Beard at the time, I think, he'd kind of done a small kind of paper on drop jumps and the different box heights you can use and potentially how you could look at using it as a training tool. And I don't want to kind of screw up what his research was, but he definitely kind of introduced drop jump as a concept. And at the time I was working with some Olympic athletes down in Southampton, some divers, where within that sport, it was a platform diver. So off the 10 meter, it's kind of a hard surface. And in my mind, the drop jump in some degree replicated, depending on the dive, some of the actions they would do to go into a dive, that kind of starting hop, as it were. So I started to use that as potentially one of the focus areas to improve. Can I improve the stiffness of these divers? Can I increase more time in the air that allows them to complete more complex tasks? That was kind of the simplicity of it. And over time, what I saw was it was sensitive to not just them getting better at the drop jump, but once a week that I would do it, I was seeing some real negative changes. And then 2 weeks later, some very positive changes. And I became aware of the fact that, hey, this isn't too dissimilar to what they did in the Eastern Bloc with count movement jumps back in, don't know when, where they would have athletes work in a gym, and at the end of their weightlifting session, they would have them do a count movement jump. And then if the count movement jump showed that they weren't any worse or had actually improved, they would get them back in the gym and continue the lift to kind of maximize their return on that workout. So from there, I kind of took it to the Middle East, and I went to Aspire and started working with the soccer teams. I thought, I wonder if a drop jump could be an effective tool to measure fatigue in these guys, like whether they're getting tired through a tournament or whether they get tired after a game. So I thought the biggest stimulus where you would see a change would be at the end of a game, right? I put you on, you play soccer for 90 minutes. Surely you're going to be tired after 90 minutes running around. So that was kind of the simplicity of the study. We had kind of 4 games, I think, in 7 days. And before and after every game, they would do a drop jump. I actually started it by doing a count movement jump and saw that they got better through the tournament. The jump heights got higher, despite them doing jumps a lot. So it's not like they improved and learned how to jump. And when I looked at pre and post game, there was no change. Like the count movement jump was like, yeah, if you jump this at the beginning, you jump it at the end. And I was like, oh my God. Stu Cormack then came out with his paper in like 2007, 8 or 9, I forget, and I apologize to him, in his AFL guys, where he was looking at CMJ, but again, he was looking at the RSI, right? So flight time, contraction time. And we didn't have a force plate, so I had a switch mat. So I'm like, well, I can't do a count movement jump and look at contact and jump height on a switch mat. I just can't get that information. But if I did a drop jump, which I've had experience with, I thought perhaps you could. So I started to use a drop jump, repeated exactly the same study, and saw that now pre and post game, the drop jump was sensitive to change. So when I did work, it affected my neuromuscular system. I wasn't as good at creating that RSI. So that was where my interest in the RSI came. I then took that to the GB hockey program for 4 years, and used that to kind of really model my periodization, demonstrate to the athletes the impact of kind of a taper on their ability to perform, would use it within competition to show coaches whether we're working too hard with some of our practice sessions leading into games. So it became a real sensitive marker to performance state of the team. And then from there, I've used it with most of the teams going forward.
So what protocol were you using for RSI?
Yeah, I kind of went with 30 centimeter, 12 inches. And the other piece that was important was like the contact time. So when you're talking about reactive strength index, you're trying to look at neuromuscular fatigue. And the clue in my mind is in the word, right? Neural and muscular. So you're looking at the nervous system, how well that works, as well as what's the muscle function. So in order to look at or stress the nervous system, you have to move quick. So Schmidt-Bleicher back in the 1980s or whatever spoke about fast and slow stretch shortening cycle, and greater than 1 or less than 150 milliseconds, that's a real stress on a stretch shortening cycle. So therefore the nervous system is having to work constantly to achieve that contact time. And so what you find is by challenging the nervous system to try and get to 150 milliseconds, which is tough, they're constantly having to stress that. So it became hypersensitive as a marker of fatigue. If some people couldn't even get there, it's so challenged. But when you're fresh, you just can. So I think it's important when you do the drop jump, and certainly in my experience, that contact time is stressed. And I'd say 150, that was the kind of caliber of athlete that I worked with, and I thought it was an appropriate marker. But what I would say is most people can jump greater than 150. It's not challenging on the nervous system, but the minute you challenge them to try and get below that, that's when you really start to see the impact on nervous system as well as kind of the muscle function. How high can you jump?
So what cues and what things were you putting in place to make sure that you were stressing the right system that you wanted to?
I would always give them feedback initially on contact time. So I would demo a lot, try and make sure they understood the stiffness qualities. I talk about keeping their shoulders over their hips, not kind of dropping their shoulders forward. That means now immediately you've got more of a knee displacement. That's that kind of more of that ankle response. I would talk about hot coals, get off as fast as you can, but at the same time, you've got to jump as high as you can. You don't want it to start looking like these people just kind of pulling their toes up on the mat. I would start to cue them to almost try and jump before you land, like all these things, so that the more you can hone that technique, the more sensitive you're going to see to change. And I've definitely had people come up to me and say, Dave, I've looked at this drop jump thing and there's nothing from a neuromuscular standpoint. I just have so much data that suggests otherwise when a population kind of gets it and can do it. So yeah, I'm a big believer. I'm still kind of using it now. I've drifted more to Stu Cormack's CMJ because there's a big familiarization period with the drop jump as well. I found it's like 8 to 12 weeks. So if you've got that amount of time to put into it, great. If you haven't, then you're going to bin it real quick, move on to a force plate, and I would say do counter movement jump.
So just explain that a little bit for us about Stu Cormack's work. Ironically, I'm actually speaking to him next week, but yeah, so good timing. But yeah, what do you mean by that?
So Stu Cormack's work was a counter movement jump. He did a couple of different tests. He did like a 6 repeated CMJ, and he did a counter movement jump. But basically, the premise of his research was that in order to identify neuromuscular fatigue, it needs to be a stretch shortening cycle with a time constraint. Okay, so he looked at eccentric, concentric phase versus jump height. So when you get tired, your technique will change. So therefore, concentric, eccentric phase will change. And then you're simply looking at the ratio of what was your output, how high did you jump, and what technique did you choose to get there? And you've kind of seen it when you see athletes come and do a counter movement jump and they look real quick. And then you see them on other days where they just take more time to generate that force in order to get the same outcome. If you looked at jump height, you'd be like, well, they're not tired. But if you actually looked at the technique modifications that now are going into their strategy, that's more indicative of neuromuscular fatigue. And the drop jump's the same, right? Does your contact time change because you can't get that system to work as well, or you need more time to generate the force to get that max height?
So did you say you'd moved away from the RSI towards Stu's?
So now I'm using, we use a number of different metrics, but one that's a big one for us would be flight time, contraction time with a counter movement jump, because everyone learns to jump. Counter movement jump's a bit easier to learn than a drop jump. Force plate is a very static piece. I know they're more mobile these days, but they're still fairly cumbersome, so you don't want to move them around. Whereas in my previous roles, drop jump and a switch mat can go anywhere. So it was super useful. So it was effective. But now I don't need that as much. So the force plate, I feel, is a good fit for the population we currently have.
So were you utilizing that at Penn State, or were the guys that you were working with utilizing that at Penn State? And if so, how were you making changes across different sports? Was the change day to day? The rate of change day to day, was that different across sports when you actually stepped in to make that change and say that guy needs a modification? Does that make sense?
Yeah, I think I know what you're getting at. So whilst at Penn State, the way it would work is we would have a number of force plates with a performance science department that we would kind of then situate around the campus, whether it's like the football gym had a force plate, the basketball gym would share theirs with whoever else, and hockey had theirs. You know what I mean? So there was like a number of them around. And so therefore it's a case of how do the strength and conditioning are the ones who are going to implement the testing, because you can't be in everywhere at once and 31 teams train at the same time. So we would support that, make sure that they understand the protocols, or at least kind of help guide the protocols and what they should do. And then the changes that would be made, I think in the Penn State example, that would be down to them to decide, is an athlete tired or not? We would help with the data, but ultimately as a strength and conditioning coach, you want to have that interface with the athlete and understand your metrics you're collecting, right? You're the one who's going to make the changes. If we go back to the Olympic setting, where I was seeing those jumps and also doing the prescription from a strength and conditioning standpoint, I wouldn't change them a lot. Like a lot of the time you want to create fatigue. That's the whole point of what we do in our programming, is I want to create an element of kind of adaptation. I don't want to flirt with adaptation. I want to actually get it occasionally. And as a result of that, I damage muscle fiber. Muscle fiber shortens, its ability to produce its force declines. Like that's a nice signal to receive. So you wouldn't necessarily make a change. When you start wanting to make a change is now when you're talking about having an athlete in a tapering phase, or a time where they need to kind of perform. That's where you're going to want to make sure that, I need to make some amendments to load exposure or particular stimulus, because they're not recovered as I thought. They're not as recovered as I thought or hoped they would be going in. So I kind of something that I should point out, because it's kind of the way I look at the whole performance piece. I see it as 3 pillars. You want to have your best athletes available to play. So you better make sure you do a good job in kind of screening those athletes, making sure that if they're predisposed to anything, you've done a good job early on in rectifying that. Then you want your best athletes to be the best athlete they can be at their particular sport. So you can do very broad brush strength conditioning, as we all do early on, but at some point you need to progress to, how do I make you better at your sport? What are the physical attributes that make you a successful striker? Do you possess them? Where do you stand as it relates to best in the world, normal, okay, bad? Because if you're missing a certain attribute, I can certainly, from a physical standpoint, start to help you improve those skills or attributes. So you got your athletes available. You're making them the best they can be at the sport. And then the third piece is, if they don't arrive on game day feeling fresh, then the chances of you winning aren't very high, because they're fatigued. They're not going to make good decisions. They're not going to perform optimally. So I think if you can look after those 3 pillars, that's what winning is about. You have your best athletes available. They're the best at their sport, and they're playing fresh. Everything else is kind of, I think you've served your purpose as it relates to helping athletes get ready.
So the last guest to feature on this Plyometrics and Jump Training Masterclass is Hakan Andersson, who featured in episode 272. So in this episode, we discussed jump training and plyometrics, obviously, but we had a little chat around where to start when it comes to jumps and plyometrics with sprinters and young sprinters, but also how that changes when working with team sport athletes. The progressions that we may have to go through, the regressions, including hurdles, but also a bit of a chat around force vectors and how he manages horizontal jumps versus vertical jumps when it comes to sprinters and also team sport athletes. Later in the chat, we have a little chat around resisted sprints, which you can check out in episode 272. I had to check then which episode it was, but episode 272 if you want to have a little listen around resisted sprints with Hakan. But this is the final guest of this Plyometrics and Jump Training Masterclass. Hope you've enjoyed it. Please let me know what you think about the new structure. I think it works a little bit better given the context around the questions, actually including the question itself from the time that it was recorded. So I hope you enjoyed it, and I will speak to you in a couple of weeks. Thanks again for your support. Can't forget that. Thank you again for your support. So when it comes to the programming of jump training for young sprinters, and then progressing through the ages, where would you start with them guys, and how would you progress that through for the athletes that you work with over there?
Well, I think, when it comes to plyometrics, if you talk about, plyometrics, what do we mean? We probably mean jumping, but there are probably throwers that has objections to that, but it's probably some kind of ballistic movement, and it's a wide spectrum, but I think, jumping is great to develop general and specific coordination, so, and it has a definite room, for everyone, and the earlier you start, the better it is, like everything that has to do with coordination is easier to learn when you start at an early age. And if you look at a playground, at least it used to be like that. You always see kids can't walk, they skip and they jump and they run around, so plyometric activity, jumping seems to be like a natural thing to do growing up, and so I think the earlier you start, the better.
So in a more structured training environment, what would that look like for them younger sprinters to introduce them to jump training and then further on plyometrics?
Well, I think you have to start with, building some kind of resilience. You can't, like I say, you can't start, intensive jump training when you're 30 years old and weigh 90 kilos. You have to start when you're young and light, and you learn coordination very, very easily, But yes, rope skipping, coordination jumps, like hopscotch kids are doing, you should start in that area. And before puberty is a perfect activity, for many reasons. And jump training it can be very intense. You know that the muscular tension, the level of neural excitement is very high, and it's that the forces are very high if we talk about the more intensive activities. So you have to be careful. It can be easily be overdone. And so it has to be administrated and with individualized progression and loads, of course.
Mm-hmm. So how is that something that you moderate? So is it just ground contacts that you would track and modify accordingly?
I mean, ground contacts only say so much, and it's also the height you're jumping from, or how much you attack the ground. We are operating with very high forces. It is very easy to produce ground reaction forces over more than 10 G, 15 Gs. When if you attack the ground and if you land from high. So it can be very, very demanding. So you can't start in that way. So it's very high forces, and you have to be careful.
So is there a way that you're objectively measuring how much volume and intensity your athletes do in terms of plyometrics?
Well, you can't talk about numbers, and you can't only talk about intensity. You have to. It's no perfect scheme. I think you have to use your gut feeling as well. It's very important. See how people are moving, how they're responding. Constant communication, like all training. So you can't say you're supposed to do a certain amount of contacts in one session, or in a week, and in a month. It only says so much when it comes to the load.
Mm-hmm. Cool. So that probably leads nicely into how you would program and deliver plyometrics and jump training to sprinters versus team sport athletes. What other considerations do coaches need to take when working with team sport athletes when it comes to jump training and plyometrics?
Well, it's like Henk Krijnhoff is the master of one-liners. He says that plyometrics is for cats, not for cows. All depends what athlete you have. Like if you take sprinters, you see a wide range of different body types. You have the greyhounds, or the very light frame, the elastic type. They often respond well to jump training, and they respond many times pretty negative to weight gains and heavy resistance training. But then you have the more muscular type. They're usually more stiff, maybe less elastic. They usually respond better to heavy resistance, but because of the body frame, you have to be more careful, and that is in a sprint situation. But of course, it's the same in a team setting. You have different kind of players, so you have to treat them as individuals, Like it can be very, very easy overdone. You end up with injury because of the intensity that can occur in some of the exercises. But I think that everyone can benefit from some kind of plyometrics. But you also have to take in consideration that is as a diminishing return. If you talk about weight training, that people respond to heavy resistance training when it transfers to speed fairly well, but it's usually a diminishing return. You have a good transfer, to a certain extent, but those last 10, 20, 30% of exact strength doesn't really transfer. And it's the same with plyometrics, that, if plyometrics was the only solution, jumpers would be the best sprinters, but they are not. So it's a diminishing return there too. If you can jump 60 meter in standing 5 jumps and you're running 10-20, does it mean you're going to jump, run 10 series because you jump 17 meters? And not necessary. So you have to understand that too, that people are different and there's no universal remedy. But I think everyone can benefit in one sense. But I've been working with ice hockey players, and you have to respect that they almost have their have their ankle in a cast for 8 months of the year. They don't use their ankle, they're because of the skating boot, it's more or less fixed. So if you get an ice hockey player that has been, the season is over in the end of May, beginning of June, and then you're going to start training him, and you start, hurdle jumps with him, you're going to run into trouble in just a couple of weeks. We have to be very careful, he can jump, but he can't land because it's such a stress on the system, especially if you're on the heavy side.
So I'd like to dive into them body type differences, and like you mentioned, the greyhound who may react differently to the bigger guys in terms of strength training, and then in contrast, plyometrics and jump training. For those body types that you may perceive them to not react massively positively to lots of jump training and plyometrics, how would you moderate that, and what would you put in the program that is still beneficial to them at a lower end, but not progressing them through the whole spectrum like you would someone who is very adaptable to jump training and plyometrics?
First of all, you have to have some objective way of judging what kind of athlete you have, and then like an experienced track coach, and he can see who is elastic and who is not, but you can also you can test people, and I think it came from Australia, like 20 years ago. They started to talk about the reactive strength index. It's the relationship between the jumping height and the ground contact, or the flight time and the ground contact. If people that can display a high RSI, they usually the elastic type. And if you are the elastic type, you can jump high in a short period of time. You most of the time you're a person going to respond well to that. So you can use objective means, or you can use subjective means. But I think to be subjective, I think you have to have a lot of experience.
So would you put all your athletes through an initial RSI to see where they are on that spectrum?
Well, I used to test a lot more, when we used to do a lot of counter movement jumps and drop jumps and so ever. But nowadays I see it more like we measure a lot in training, you have to see how they're responding, and in terms of sprinting ability, we used to put a lot of emphasis into counter movement jump to try to jump as high as possible. You could see a transfer from weightlifting to jumping, but many times you saw no transfer to sprinting. But when it comes to reactive strength index, I think it's a better test actually. People that at least the light frame, the elastic guys, when they score high in the RSI, they're usually in pretty good condition, good shape to run fast times.
I'm trying to put a number on it, like I am with everything. But what would fit that bill in terms of a score for RSI to make you think this guy's elastic?
Well, I think there are different means of calculating RSI, if I recall correct. It's at least three methods I've seen. It's the flight time divided with the ground contact time, or the jump height divided with the jump contact time. There is also, I've seen in some literature described as the jump type divided with the time to take off. But if you talk about the relationship between time flight and time contact, we have guys that score almost 4. I mean, if you talk about the relationship between jumping height and contact time, you're around 350. But it's also interesting because you can also talk about power, like Bosco was talking about 30 years ago. There's a relationship between the power output and the RSI. So when they have high RSI, they have a high power output per kilo body weight, and you see numbers of exceeding 80, 80 watt per kilo, when they're in good sprinting shape.
Mm-hmm. So there was a trend about a year ago, maybe 18 months ago, 2 years ago, of being quite hung up on force vectors and the inclusion of horizontal jumping, vertical jumping, the transfer that has different phases of the sprint. What's your view around that, and how do you incorporate both horizontal jumping and vertical emphasis jumping in your program?
Well, like both vertical and horizontal plays is important in sprinting, and I don't really understand the debate. There seems to be a vertical camp and a horizontal camp. They're so connected. And people are so obsessed about talking about contact times, but they forget sometimes about contact length. We have to move the center of gravity on stance phase in a certain time. And the contact time is actually also the outcome of running velocity, and velocity at toe off. When it's outcome of the magnitude of force impulse and the direction of the applied force. So they're connected. So try to mimic the contact times. If you say that a top sprinter has a contact time in between 80 to 90 milliseconds, but that is he's moving his body mass, his center of gravity horizontally. And if you try to mimic that by addressing that when you're jumping vertically, there's a totally different thing. The flight phase in sprinting is not more than 3 centimeters. And you attack the ground, so you can still achieve fairly high ground reaction forces vertically. You see numbers from labs, up to 5 times the body weight, but you're also moving center of gravity horizontally. So both vertical and horizontal, forces play a big role. And in the initial acceleration, when the body has an incline, of course you can produce a lot of horizontal force, and you can use even the knee extensors extensively. You use all joints. But in a vertical position, of course, in a upright position, of course, the vertical component is getting higher and more significant. But if we want to keep on accelerating, we got to make sure that the propulsive forces in a horizontal way is exceeding the braking. Else we don't have any acceleration, at least according to Newton. So and jumping, of course, we can train both sides of that. We can jump vertically. Almost anyone can jump vertically. And especially doing it with double legs. But unilaterally, like bounding, jumping horizontally is more tricky, and the forces are high because of the speed. So I think jump training should be a combination of both. But like vertical jumping is more to develop stiffness maybe, and horizontal jumping is also hip extension. It's not only absorbing force on the ground, producing force on the ground vertically, it's also horizontally. So it has to be a combination of both, I think.
So if you're working with a team sport athlete, for instance, a rugby or soccer player, obviously a heavier emphasis on acceleration, would that lead you to move more towards the horizontal jump training or not?
Yeah. I think I would, but it all depends on the experience of the athlete. If you start as a strength and conditioning coach, in a rugby club, and you have some heavy guys, older guys that has never done any kind of plyometrics, I would avoid it like the plague. I would be very careful at least. Maybe I could jump upstairs and things like that, but you have to respect the landing, the impact forces that it can create, especially if you're jumping on harder surfaces. On grass, turf, maybe a little less, but you still have to be careful if people are heavier.
So that's interesting, because with them heavier guys, would you avoid it completely, or would you start super low down that intensity spectrum? And if so, what does that actually look like? I know you mentioned stairs there and different surfaces, but is there anything, other considerations that people should take with them heavier guys?
You have to take in consideration the jumping height too. Like if you're going to jump down those stairs, maybe you can, you have to keep it fairly low because of the body mass and their relative strength they're probably going to produce a lot of force, and it's but it's usually not the muscle that's a problem, it's the tendon.
So again, in that sort of environment, like a rugby or a football, and you are concentrating on that horizontal force production, where would you? I know again, it depends on the athlete, depends on the coach, but if you were starting off with athletes that had not done a lot of plyometrics before, how would you progress them? Where would you start? What kind of exercise and prescription would you be looking at, and how would you move the needle on that?
I would start them as kids.
Yeah.
I would start with a low impact. I would start skipping rope. I would do things like that and see how they respond. And I think I would progress it very, 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 very slowly. And not make a program for everyone. They have to see how everyone is responding. And if they're coordinated or not. I've seen sprinters that started plyometrics when they're way over 20, that are very coordinated. They could learn it and they could benefit from it. I've seen, Linford Christie, the jumping fairly impressive. It wasn't serious with his athletics until he was way over 20 years old. But he was still a good jumper, even though he probably weighed between 85 and 90 kilos. So it can be done, but it's all depends.